going to start by putting some clear surgical tape on the upper and lower lashes, and then insert another eyelid holder. As I mentioned before, none of this is going to be uncomfortable or painful. That part's over with as far as the discomfort goes. He's had the Valium and the numbing drops, and so he won't feel any of this, and it's not all that invasive. It looks way worse than it is. So there's the surgical tape to keep his eyelashes out of the way. And there's the eyelid holder. And once again, any of those red blotches on there are caused by the suction from the first part of the laser, completely normal, and they'll take probably up to 2 weeks to go away. Again, the top of his eye is at the bottom of the screen. Now you'll actually get to see what we saw in the first part with the flap being created. We'll actually see it as a flap as soon as he releases it from the rest of the cornea. Dr. Scoper is going to put some temporary markings on the surface there. That's a visual indicator for him that when he pulls the flap up and does the correction and puts it back into place, that he's got it lined up properly. He doesn't have to have that because when the flap is actually created, the laser, it goes in on an angle, so it creates a little ridge around itself, so it naturally rests inside that ridge. But Dr. Scoper is a perfectionist, and he wants to make sure that he's got everything lined up the way it should be. That's for the patient's benefit. And we'll see the benefit of those markings in just a couple of minutes here. But they will wash away. Just the normal blinking and tearing and the drops and stuff, they'll probably be gone by this evening. So he's going to get the flap started, and it's going to stay attached at the top of the eye, which is the bottom of the screen. And he's going to use what they call a Lasik spatula and go all the way up underneath the surface of the flap and separate the flap from the rest of the cornea. Now, to me, it looks like a piece of cellophane.
Yeah, it does.
You know, Glad wrap, Saran wrap, whatever. Yeah, it's pretty exciting. Our eyes are so fragile, but then again, they're so tough.
Yeah.
So there's the flap. Now, the surface of the cornea that is going to be resculpted to correct his vision is the area right there around those red lights.
Mm-hmm.
Now, we may or may not hear it. I generally don't hear it, but when the laser starts to fire, we'll either hear it and or see it as a glistening effect right in the area of where those red lights are. And I'll call it to your attention as soon as I notice it. It's very quick and very subtle, so sometimes it's harder to detect. There we go. That's the actual laser firing and resculpting that surface. And it's resculpting to the tune of it's either flattening or steepening the surface to compensate for his vision error. And again, he doesn't feel any of this. There's no pain involved here. And that's it for that eye. So the correction has been done. They're going to irrigate the area and put the flap back up into place. And you can see the benefit of those circle markings. Dr. Scoper's going to go around and make sure that all the edges are secure. There's no wrinkles in the flap, no air bubbles. That's why it's also important when he gets home. I don't know if there's small children or animals at home, that they need to stay out of his face, okay, for the next, today especially, but for the next few days. Because we don't want anything to wrinkle that flap. And of course, he's been told about wearing goggles to bed to sleep in, and when he naps and that, yeah. But that went beautifully. And again, just making sure there's no air bubbles or wrinkles. Securing the edges. The natural pumping action of the eye actually holds the flap back close to the corneal tissue. Dr. Scoper always puts the first set of drops in before the patient, when he's done with each eye. That way the patient can go home and just take a nap and let the Valium kick in and let the numbing drops wear off. And then when they wake up, they'll start their normal routine of drops. So you don't have to worry about any of that until after he goes home and takes a nap and wakes up from that nap. But that went beautifully, so they'll move on to the next eye.